My name is Rachel Snow, and I will be practicing at Wayne and King of Prussia. I'd like them to know that I'm here and I care, and whatever issues you have, try to help navigate them with you. I'd like them to know that actually, yeah, that I'm here and available. And if they have questions, this is my level of expertise on this is pretty high. And so, and I know that a lot of referring providers have lots of different funds of knowledge, but this might not be something that they're as familiar with. And so, any questions, any concerns, anything, I'm available and I'm a resource. So, um, you know, I'd like to be as available as possible if any questions come up, or if you have any concerns about any shared patients, happy to help. I think treating patients, with respect is obviously and understood. There's no question about that. But trying to work collaboratively and trying to understand what their goals are is really important, because what I see on an ultrasound may be completely different than what the symptoms are, and so if we can talk and have some sort of shared understanding and come to a treatment plan together, I think that's useful and good medicine.